everybody. Welcome back to the Namaste Wellness Show, where we talk about all things holistic health for the mind, body, and spirit, for people and pets with a touch of cultural soul. My name is Laura. I'm your host. Thank you so much for being here today. I'm welcoming back Dr. Dennis Bloom of Bloom Chiropractic. He was on the podcast last September, as a matter of fact, or last year, talking about the mind and body benefits of chiropractic care, or how chiropractic care can be a holistic practice or a holistic healing modality for people. So welcome back.
Thanks for having me on your podcast.
You're very welcome. Glad to have you back. So today we're going to talk about some more conditions that chiropractic care can help with, as well as some of the tools that Dr. Bloom wants to share with us, so that to kind of compare with the old school way of cracking necks and different things like that. So you can, if you know, whatever you want to start with, if you want to start with the tools, or you want to start with the different conditions, we can, wherever you want to begin,
Oh yeah, we can address some of the different options that chiropractors have as far as delivering adjustments.
Mhm.
In our last interview last year,
Mhm.
we talked about the subluxations of the spine that create nerve pressure, and that it's important to do adjustments to the spine to relieve that nerve pressure.
Mhm.
Some people watch YouTube videos and they see all these like really traumatic looking cracks being done on people, and they think that's all that chiropractors do is just crack backs. And that is part of what we can do for sure. Some people really benefit greatly from the manual adjusting where you get cracking of the back done. But like Laura herself, she got her adjustment today,
Mhm.
and we just used a tool, a couple different tools. This one's called an activator, and there's many different versions of it. But the idea or notion is you don't have to do a forceful adjustment to help benefit from chiropractic adjustments. So this tool, the activator, is like a plunger type device, but you place this on the vertebrae, and by tapping on the vertebrae, the tight muscles that are causing the nerve pressure to develop in misalignment, they will start to relax and release from that tapping. Now, you can also accomplish that by cracking, right? But you don't have to have that type of treatment done. I have many patients in my practice that all we do is use this little instrument to tap on their vertebrae, right? And it gets the job done. This device here, this is called.
And I want to just
Yes.
pause for a second, because we have listeners as well as viewers. So maybe kind of describe, this is the tapping tool that he just uses, just a very small handheld tool. So I know if you're listening, you won't be able to see it, but I just wanted to give a little more of a description. So the next tool you're using is more like, it looks like a gun almost, and it's a larger tool.
Yes, and it's against a handheld instrument.
Mhm.
It's a rapid fire electronic version. So I'll set it off now. And the idea is you place this device on the vertebrae that need to be adjusted, and you can, using that rapid fire, it makes the adjustment as well. So this is, again, a more gentle way to get adjusted. You don't have to get cracked, right? We also use, and we can't show this on our video, but we use tables that have drop pieces in them, so we can place our hands on the vertebrae that need to be adjusted, and the table drops away underneath, so there's no cracking done with that either. So I wanted to use this opportunity to, and Laura and I had talked, that not everybody understands or realizes that there's different ways to adjust the spine, and I just wanted to share that with people. And I've had a number of patients come in, their medical doctors were referring them in, but they didn't want their necks cracked, right? And I totally respect that. I say that is not a problem. And I think a lot of medical doctors don't even realize that there are these tools available to make the adjustments, so we don't have to do any cracking.
Well, let's hope maybe we'll have some medical doctors watching, and they can find out that these tools do exist.
And they can tell their patients, oh, I think you should go get adjustments from a chiropractor, but just make sure they use the more gentle techniques.
Exactly.
Right, like the activator, this is called the impulse instrument, and there's different tools out there. This is just a couple of the ones that I like to use.
Right.
So I just wanted to sort of make that clear to people that you don't have to get your bones cracked, but I still have patients that they like the manual adjusting. I just try to use the least amount force necessary to make the adjustment, right?
Now, would you use a gentler tool for an older person compared to a younger person also?
Absolutely, especially if there's a history
Mhm.
of having osteopenia or osteoporosis, right? We want to be careful not to injure anyone. We don't want to break a rib or fracture a vertebrae or anything like that.
Not
So
to
there's risk.
assume, and I don't want to assume that the older person, because every older person may not have, there may be younger people that have that same condition
Absolutely.
too. So it really depends on your own, whatever your,
I've had professional athletes
Mm.
prefer this be used to
The
adjust their
smaller.
neck than the cracking of their neck.
okay. right.
So, and I've had little old ladies, 80
Yeah.
years old, that like their
wanted to
necks
get their necks
cracked
cracked.
versus using it. This wasn't strong enough for them.
Oh, wow.
So it's not necessarily an age thing, right?
Right,
But you have a discussion, as part of the history to see what they're comfortable with
Right.
Right.
And what their history is.
and what
as
their
well.
history is, yeah.
Okay, so tell us about, now this is the scraper tool that you have, and again, you can't see this if you're listening, but it is literally looks like a scraper.
Yes, indeed.
Yeah, and.
Yeah, so this can soften up adhesion. So Laura and I were talking about some of the conditions that can be treated with
Maybe
chiropractic
give
care.
example maybe of the frozen
Of the frozen shoulder, yeah,
Yeah.
so you can use this device, this scraping tool, to soften up the adhesions that have formed in the capsule of the shoulder. So I utilize this tool for cases like that. And then I also have a device, it's a massager device called a rapid release. And this one is a very high speed massager device, but that can be used to help to soften up the adhesions as well.
Mhm.
And then I follow that up with isometric stretches to try to increase the range of motion. So that combination I have found to be works really well in helping to get frozen shoulders starting to release and open up, but it takes time,
Mhm.
right? There's no quick,
you-
easy fix for frozen shoulders, for example.
Yeah, and you also mentioned that the first thing you would do in the case of something like a frozen shoulder or an injury, that you would first do the adjustment or release the subluxation
Correct.
so that and you can explain it better than me, so that the nerve, the
nerve flow, yeah,
the nerve flow.
the brain is sending its electrical signals. So the brain up
Yeah.
here can send its electrical signals down the spine and out these nerves to whatever body part is injured. Because things heal better if you have optimal nerve flow flowing into those body parts.
Right, so you open up the nerve flow by doing the adjustment first.
Yes.
And then use the other tools on the areas that are inflamed or the muscles that are tight and whatnot. So it's kind of, some people might be surprised that, a chiropractor uses quote unquote massage tools, like, things like that too.
And not all chiropractors do,
And
so
not
you can ask and see if they do that.
Yeah, I would consider you more of a holistic chiropractor, because you do use other modalities and am I saying, I guess modalities,
Yeah.
kinesiology,
Adjunctive therapies. yeah.
adjunctive therapies, et cetera. Okay, so I didn't mean to cut you off if you had any.
Yeah, I
Yeah.
just wanted to cover the last tool I wanted to show, and a lot of people can buy these on their own. They're percussive massagers.
Yeah.
So I
Very
oftentimes,
popular now. by
they
the
are,
way.
yeah, and I oftentimes use this in conjunction with my adjustments.
Mhm.
I would say 75% of my patients like the massager device done.
I'm one of those.
She's one
I
of them,
love-
yeah. So I do massaging techniques, so I combine that with the adjustment, with the different tools that we can utilize. So like Laura said, I try to do a more holistic approach towards that.
Right.
And of course, I'm a big fan of rehab type of exercises and stretches and things of that nature. So Laura and I were just talking about, some of the ways that we can enhance our, so when,
Yeah.
for self-care, right? So we use things like foam rollers. So I have a 4.5 minute video on foam roller usage. So
And how can you view that? What do you go?
there
to?
is a YouTube link,
Mhm.
which I don't know it off the top of my head, because
Oh, okay.
one of my assistants, Krista, she always sends that to the patient when they want to see that
Oh.
YouTube video.
Right, okay.
So I don't know how to do that
Oh, okay.
myself.
Well, you would have to call the office and
Call the office
ask
and we can-
Krista. and,
Yeah, we can send you the link for the YouTube video
yeah.
on how to use the foam roller. And I have a nice section in that showing how to release tension out of the spine. You can use it for your shoulders, you can use it for your hips, your thighs, your forearms. But the spine is something that I don't see a lot of YouTube videos showing how to do the releases on the spine.
Well, speaking of the spine and the vertebrae, can you tell us a little bit about, do all of the vertebrae innervate, I guess you say, send nerve responses to the different parts of the body? So, how does that work? Or can you say, C7 innervates what? Cervical, vertebrae number 7, or
Yeah, so the
lumbar number
different muscles
4.
are innervated by the individual nerves, and that's a whole course of neurology, right?
Oh,
we're
okay,
not
so
gonna,
it's neurologic, right?
yeah, we're not gonna go down that road of
Okay.
trying to explain all that type
Yeah.
of
But that
information.
is
But
how
that's
it
the basic
works.
concept. You
Okay.
cannot move a muscle
Mhm.
unless your brain sends an electrical signal down your spine, out a nerve that is then connected to that muscle, so the muscle can contract,
Okay,
right? So that it just can't happen unless you have a nerve connection there.
okay. So the nerve is going to the muscle, not necessarily into an organ.
No, it goes, yeah, so nerves go into the
okay.
organs as well,
Oh.
so there's different parts of the nervous system, the sympathetic and the parasympathetic.
Okay.
There are ganglionic nerves that run up and down the spine.
Mhm.
So there's like a whole central nervous system and peripheral nervous system
Right.
setup.
Okay.
So again, I didn't want to go into the whole
Yeah,
this
that's
whole
a whole
neurology.
nother stuff.
But what I tell people
Uh-huh.
is all of your muscles, you got 640 muscles in your entire body,
Mhm.
approximately.
Mhm.
All those muscles get their nerve supply from the nerves coming out of your spine.
Mhm.
So in order for a muscle to work properly,
Mhm.
a subluxation weakens the nerve flow, which
Okay.
then weakens the muscle, affecting the normal function of a muscle, right?
Mhm.
But with the internal organs,
Mhm.
a subluxation can weaken the nerve flow to an internal organ,
Mhm.
but there's something called cranial nerves that bypass the spine. So that's why somebody can break their neck,
Okay.
become paralyzed because the muscles aren't getting the nerve supply,
Okay.
but their organs can still function because you have
Oh.
these cranial nerves like the vagus nerve
Oh,
that
okay.
feed the organs
Uh-huh.
messages from the brain so the organs can keep working properly.
Okay, that makes sense.
Yeah, so thank goodness there's a backup system for the
Right,
organs,
yeah.
right? We don't have a backup system for the muscles.
Well, oh,
They
okay.
all are controlled by the nerves coming out of the spine,
Wow, okay.
right? So the organs have a dual system controlling.
Okay. Interesting, okay. So you know, if you want to go ahead and maybe talk a little bit about some of the conditions that you wanted to share, that can be helped with chiropractic.
Well, I know, Laura, we were talking about the mind-body connection, right? So, the mind being more, what's more relative to us is the stress, right? We get stressed out from everyday life.
Right.
So how does chiropractic relate to that?
Yeah.
So what we find is that when you get stressed out, your body releases stress hormones like cortisol and adrenaline,
chemicals.
epinephrine, adrenaline, and that can tighten us up, right? Tighten our muscles up. It
Oh,
also activates the sympathetic nervous system, which can tense us up. So all of a sudden we get all this tension building in our bodies from
In the
mental,
muscles.
from our minds, in our muscles.
okay.
So when we get tension built up in these tiny muscles between the vertebrae, that can start to cause subluxations, which can then affect all of our muscles and all of our organs. So when we get adjustments, it can release that tension, which helps to reduce the amount of harmfulness that stress has on our body, right? But it does not cure anxiety, it does not cure depression, but we can combine chiropractic with nutrition to help to treat those conditions, right? So as chiropractors, we are only allowed to treat subluxations of the spine. So we can't claim that we treat depression, we can't claim that we treat anxiety, but we can do adjunctive therapies to try to help those conditions out. Right?
Okay.
So that's sort of the mind-body connection that you wanted to touch upon.
Sure, okay. So, I like to call it the mind-spine connection.
Yes.
Okay. So, tell us a little bit about, I wanted to talk about some, kind of, I guess you could say some common conditions that, are related to what we would call back pain. So I think I read somewhere recently, like 80% of Americans suffer from some form of back pain every year. Would you agree with that, or?
That's a high percentage. I didn't see that statistic, but I know it's a lot. I mean, it's one of the biggest reasons for like people being injured and not being able to work, for example. But
Right,
also just being able to carry on, they get disabled because they can't carry on normal life functions because of back injuries, neck injuries, things of that nature.
okay, okay.
But I'll take your word for it, percentage wise.
We know what, that's why I don't know, don't take my word for it, but I know it's a high percentage though. That people that suffer back pain, and I know you see people that have back pain probably on a daily basis for one reason or another. Whether they've been injured in an accident or whether it's just pain that started because of whatever reason.
From repetitive use or from their
Repetitive use.
posture, their
Yeah.
sleep posture, their work posture, whatever it may be.
Right,
People are sitting in chairs more than ever before,
right,
right? Because they're working on a computer. So that in itself creates stress on our bodies, which then chiropractic care can oftentimes help to relieve the problems that arise from those postures.
okay. So talking about, say, if you can tell us, what is spinal stenosis? Is that, and would that, oh, wait, is that?
Well, I mean, it's sort of an in-depth explanation, however.
Oh,
So there's two types of spinal stenosis.
okay,
So one is you see where these little nerve roots are coming out,
okay,
and unfortunately, this is an old spine and I'm missing some of them.
oh,
But this is called a foramen.
okay.
This is called, if the bone spur grows inward
Uh-huh.
or a disc bulges inward or swelling from the joints go inward, that's stenosing of the intervertebral foramen.
Okay,
So that's called foraminal stenosis.
okay, so I really
So you can
started with a.
you can get stenosing
Okay.
of the nerve roots coming out from the spine.
Uh-huh.
And then there's canal stenosis, which is that's the spinal cord, and you really need to take this and look at it like that,
Oh,
right?
okay.
Where the cord is going down there. So again, if you get things growing inward that
Oh,
press on the
press on the
cord,
cord,
that's
that's
spinal cord stenosis.
stenosis, okay, okay.
So there's two different types of stenosis.
Okay.
So depending on what is stenosing, what is causing that
Pressure
pressure,
on the cord.
if it's
okay.
bulging discs, if it's swollen facet joints, chiropractic care can be very successful at helping to reduce that.
Okay.
If it's bone spurs,
Mhm,
it's a 50-50 chance. Sometimes adjustments will help that,
mhm.
but sometimes you need to get surgery for that,
Okay.
right?
Okay,
Now,
but
massage
that's a good-
therapy, acupuncture, physical therapy can
Mhm.
all be very beneficial in helping stenosis as well.
Okay, because it'll help to take the pressure off the cord. So maybe even a tight muscle can.
The tighter the muscles
Uh-huh.
get, the greater the chance that things are compressing together.
Okay,
So therefore, when you release that tension,
okay,
then the pressure can come off of either the nerve root or the cord.
okay.
But sometimes the bone spurs are just too big, and no matter what you do, it's just not enough.
Okay,
And you have to go in there surgically and remove that.
okay. Well, you saw me laughing and thinking, oh my God, did I ask a really complicated? But the bottom line is, we're talking about in stenosis, the pressure on the cord that
Yes.
goes through the vertebrae.
Yeah, or the nerve
Or
roots
the nerve
as they
roots.
exit
Okay,
the spine. There's
gotcha.
two types of stenosing.
I see, okay. And you said that, chiropractic that's something chiropractic could really help.
Yeah, yeah. So
Elected has, the bone spurs.
the bone spurs are always the limiting factor as to how successful we are. Like I said, bulging discs,
Mhm,
swollen facet joints,
mhm,
the stenosing caused from those types of events,
Mhm.
we are very successful at helping.
okay.
The stenosing from bone spurs, it's tougher.
So what is a bone spur? Is that the bone growing out of just?
Of its normal contour,
Okay,
right?
uh-huh,
It creates a hyperexostosis,
okay.
osteophyte, there's all these names for it, right?
Yeah, technical names,
But
okay.
the theory is that when tension builds,
Uh-huh,
the discs start to degenerate. So I
Uh-huh.
tell people a normal healthy disc is like a raw juicy steak,
mm,
and a degenerating disc is like a piece of beef jerky. It's drying
Oh,
out. So as that
gotcha.
occurs, now the bones are getting closer together. That creates an electrical charge on the bones that wasn't there before,
mm.
and that attracts calcium ions to build up there.
Oh, okay. So it's actually getting bones first.
The bone is building where it shouldn't be building.
Shouldn't be
Yeah.
building,
But it's
okay,
because of that degenerative process going on and this electrical charge that forms on the bones as they get closer together.
okay. So the degeneration can come from anywhere, but I imagine that if the nerve is not feeding properly or something, could that cause
when you-
degeneration in the
That's part of it, right?
okay.
So when you get tension building up in the muscles
Compression is
between the
being
vertebrae,
compressed.
you're compressing more.
Yeah.
Now you're bending, twisting, moving and doing
Yeah.
all your daily life activities.
Right.
Then that disc starts to get wear and tear on it at an accelerated
Okay.
rate because of that tension that has built in the spine.
Okay, okay.
And it may be symptomless.
Yeah.
You may not even be aware of it. And it can be occurring over the course of years.
So even, people that, we live in a society where people are doing more exercising, they're trying to do so many things to stay healthy, but even doing something like repetitive exercise can cause that degenerative process to begin to start.
Absolutely.
This.
Yeah.
Okay.
So doing
that's
self-care
what-
things like we're
self-care,
talking about, like the
yeah.
foam rolling. We haven't really talked about this on the podcast, but we're talking
Yeah.
about dynamic stretching, static stretching, but then also
Massage.
getting the massages,
Yeah.
getting the adjustments. That's all things that we can do to try
Right.
to manage our stuff,
Right,
right? Because tension's gonna build just like plaque builds on our teeth,
right.
tension builds in our spine, tension builds in our body. So this gives us a
Good
tool to
point.
help manage it. Hopefully, we can manage it so we don't just start popping pills. Because those
Exactly,
pills will
yeah.
damage your kidneys, damage your liver, damage your stomach lining,
Right,
right? They have their place,
yeah,
right? They can get you out of a really bad bind when you're in severe pain,
right.
but do you want to live on those pills?
Right, and
That's the thing.
and many, pain pills can become addictive. too.
They can. We all know the opioid crisis and all that stuff, how many people have died because of it. So
Yeah.
to avoid that stuff is a really good idea, but it has its place,
Yeah,
right? For sure.
well, okay, so maybe talk a little bit about, I know sciatica is a common problem that affects people's lower back, hips,
Yeah,
et
sciatica
cetera.
is a tough one too,
Okay,
because the sciatic nerve is the biggest nerve in the human body. So when it gets angry,
Mm.
it can take a while for it to heal. And it
And
can
it
be a
really
bugger to
gets-
get rid of.
One of the reasons it gets angry is because the muscles pressing on it. And again, we're talking about sending the nerve energy down there to relax the muscles. And then working on any inflammation and whatnot, doing some of the other various tools and techniques that you would use. So,
Yeah, so adjustments
uh,
can be very beneficial in helping to get sciatica to start to turn around and start to heal.
mhm.
So we can adjust the vertebrae, we can adjust the pelvis, and then doing muscle techniques to release like the piriformis muscle, which is a muscle that connects
Yeah,
between the
presses on.
pelvis and the sacrum. So massage therapy is great for that as well.
Right, right.
That's what Laura does.
Mhm.
So there and then giving people stretches to do. So there's a whole litany of things, but it's a process to help sciatica. It's not like, oh, one treatment and the person's fixed, it's like, I wish.
Yeah,
On occasion,
Well-
you get results like that, which is wonderful, but it's usually a process that takes time.
yeah. Well, usually with anything like chiropractic or massage, it's really, they're basically maintenance tools because as you said, we're continually moving our bodies and living our lives. And so, and we have habits of movement and the way we move our bodies and hold our bodies or sleep or sit or whatever you're
That's
doing.
right. Yeah.
And so.
Your daily life is
Your
going to
daily
build
life.
tension and stress on your structure, on your muscle system, your structure, which will affect your nerves, which will affect your organs, which will affect your health.
Right.
So that all cascades like that. I like to use the term management tools, right?
Yeah, manage.
So we can manage our stuff.
Right, manage, yeah. So chiropractic, massage, yoga, whatever, these are management tools.
Yeah.
Scoliosis, people are usually born with scoliosis, or is this something that can happen to you after,
Usually we're born with scoliosis, that a vertebrae is oftentimes misshapen,
Mhm.
right, when it develops. And that's what creates, so scoliosis, if this sacrum or fifth lumbar, for example, if the right side is shorter than the left side, then what ends up happening, the spine curves that way. And then that's how you get the curvature like that. That's scoliosis.
Gotcha.
Now you can, as long as scoliosis isn't interfering with your breathing and your heart function, there's a good chance you're gonna live a long life with scoliosis. However, the apexes of the curvatures, like apex here, the apex here, wherever the curvatures are, they tend to degenerate faster
Oh, okay.
because there's an
Compression.
inherent compression going on there, which leads to that same phenomenon of the electrical charge, which leads to the bone spurs, which leads to and the degeneration. So I always like to tell the story though with scoliosis, if you're familiar with track and field, the fastest sprinter in the world, Usain Bolt, has a world record in the 100 meter and 200 meter. He has scoliosis,
Really?
but yet he's the fastest human being on the planet. So
Oh,
that's pretty cool.
yeah.
So but scoliosis is something that, again, you should try to manage throughout a lifetime. We can't cure scoliosis, but there are some techniques out there that actually try to reduce scoliosis, and they do have some success with it.
Mhm.
So I don't utilize those techniques because they are very extensive involvement. So, but
Okay.
there are some facilities that some doctors that specialize in treating scoliosis to try to straighten it out as much as they can.
Okay.
You can't straighten it out perfectly. I'd rather do that than getting rods put in my back.
Okay.
Right.
Yeah. Well, I do have a few clients that have it, but they don't seem to feel that they need to have surgery, and they're living with it, like you said.
Yeah, you can manage it.
You can manage it. So it wouldn't be any different with scoliosis than anything else. Chiropractic would basically try to get that nerve.
Exactly, but you still try to find the
Well,
areas of subluxation in the spine, adjust those areas where the tension's building and the nerve pressure is building.
Yeah.
And then the idea or notion is the person can do exercises to try to do we call them mirror image exercises. So if you're curved this way, we give you exercises to curve you
go
that
the
way.
other
Yeah.
side. Okay.
But
got
people
it.
have to be diligent with it. They have to
Right.
stick with the exercises and make it part of their lifestyle.
But they help too, if you do them.
If you do,
I
yeah.
think almost any tool helps. You know, a lot of people say, well, I tried this, I tried that, it doesn't work. And every tool is not for everybody.
True.
And that's okay, and that's understandable, but I think being diligent and making it
Sticking with stuff.
sticking with it does help. Okay.
We were just
so-
talking about that with Laura's husband,
Yeah,
Sheldon.
yeah.
Doing some of
With his
the
workout.
Yeah.
that It's hard for him doing the recovery or the,
post-workout, the
Post-workout.
pre-workout
Yeah,
dynamic
post-
warm-up and the post-workout static stretching.
yeah,
So that the dynamic stretching before a workout helps to warm your body up, ready for exercise.
right.
And the post-workout static stretching helps to cool your body down and help it to recover. And her husband was saying, yeah, I'm not really taking the time to do that stuff. Right.
Yeah.
So that's what we were having that discussion about. He knows about it, but he's just not taking the time to do it.
Right, yeah. Well, I think we're all guilty of that in some area of our lives, right?
Absolutely. Yeah.
So, yeah. Okay, so you had also mentioned how chiropractic can help with knees,
Absolutely.
ankles, feet, and all that.
Yeah, so
you wanna talk a little
chiropractors,
bit about
yeah,
that?
so some chiropractors are trained in working with the extremities. So like when people have plantar fasciitis, or foot pain in general, I mean, there are conditions that obviously need a podiatrist to intervene and work with them. But oftentimes if it's just a structural problem where their feet are getting misalignment in the 26 bones of the feet, we can do adjustments to help to realign things, to help to get better function in the feet and help to relieve the pain.
Mhm.
But again, we always tie it in with the spine, because if you have a subluxation in the spine, that's going to weaken the nerve flow down to the feet, all the muscles that help to regulate and control the function of the feet. So we always want to make sure we adjust the spine, get that nerve flow going, and then we can work on the feet as well. So we combine those together.
Mhm.
And that goes for like the knees or the hips, for the wrists and hands, for the elbows. So whether it's tennis elbow or golfer's elbow, whether it's a frozen shoulder or whether it's just an impingement in the shoulder, we oftentimes can help those kind of conditions,
Mhm.
working with adjustments to the spine as well as working with the extremity.
Okay.
We also do some work with I work with the TMJ, right? So, and those can be tough ones, because when does that ever get a rest, right?
Yeah.
But you got 5 muscles on this side and 5 muscles on this side, and they can get all tensed up and locked up. You can get fascial restrictions. So doing the massage, doing the different techniques that we were talking about, soft tissue techniques, trigger points, that can all be beneficial. And I do a gentle adjustments using the activator. I can actually adjust the TMJ with the activator. We can also do cranial adjustments too, just doing gentle manipulations of the cranium.
Okay. Okay. Well, there was something, and I just lost my train of thought. I was going to bring up about that. But one of the things I wanted to say, the reason I brought up the different vertebrae and how they innervate different parts of the body, it's kind of what you're talking about. Because if you have a foot problem, you would go to that vertebrae or focus on adjusting that vertebrae. So that's kind of what I was meaning, not to sound so complicated, but
But it's not that simplified either.
it's not that.
There isn't
simplified.
like, well, if you have foot pain, it's L5. If you have ankle pain, it's L4.
Okay.
If you have knee pain, it's L3. And it's not that simple.
Okay,
Unfortunately, it would be wonderful. If you have a gallbladder pain, it's T4.
right,
It would be nice if you could just T4 and their gallbladder would heal up and.
right, so
but
it's nothing.
No, but adjust, it may be T4.
Uh-huh.
It needs to be adjusted to help your gallbladder.
Uh-huh.
But then we also would want to do nutritional work with the liver and the gallbladder to help that. So that would be something that we maybe want to talk about, is some of the nutritional work that can be done.
Sure, so you all do offer nutritional supplements here. Are you
I
talking
do.
about nutritional supplements, or actually you have a nutritionist on staff?
I do
that
not have a
creates
nutritionist on
diet?
staff anymore, no.
Okay, so the
So I'm going with the supplements, so
okay.
there's reflexes, and this is based upon like Chinese acupuncture, traditional Chinese medicine.
Right.
But there, and work that Dr. Goodhart did with applied kinesiology, there's these reflexes on the surface of the body that correspond with your organs and glands. So through muscle testing, we can find where a reflex tests weak upon muscle testing, and then we can find the nutritional support for that particular organ or gland. Combine that with the adjustments to get the nerve supply going into, so somebody who has acid reflux or GERD or heartburn, we can oftentimes do a supplement called Gastrex, which helps to heal any inflamed tissue in the esophagus from the acid refluxing up, but also help to ease up some of that acid. But we also do adjustments to the stomach to help to take pressure off the valve on top of the stomach so the valve can start closing better. And I teach people how to, I do the adjustment on them, but I also show them how to do the adjustment at home. And you combine that with adjusting the spine, right? Because we want the nerve flow going to that organ to be at its optimal.
Right.
So that combined together with the dietary changes, like avoiding the foods that trigger reflux.
Okay.
So whether it's
That makes
chocolate or whether it's coffee, and then eating a big meal late at nighttime and then going laying down in bed and that triggering. So you got to incorporate this holistic approach to all that.
Right.
Yeah.
Well, you were touching on some of my bad habits to
Indeed.
eating a large, thank goodness, so I don't think I have the acid reflux,
Yeah,
but
which
I
is
might
great.
eventually, get it if I don't.
But
stop doing
that
it.
sort of ties in the nutrition. So
Yeah.
when it comes to musculoskeletal issues, like if somebody's got tendinitis in their shoulder or in their elbow, so we can use enzymes taken on an empty stomach to help to reduce the inflammation. We can use things like turmeric and boswellia to help reduce the inflammation. For muscles that are overly tight, we can use valerian. We have a product called Formula 303, which is valerian, passiflora, and magnesium that helps to relax the muscles. So that's sort of if you go to your medical doctor, you'll basically get pain pills, muscle relaxers, and anti-inflammatories to treat an itis, like a tendinitis or bursitis. So we have like herbal versions of that or homeopathic versions of that. So that gives people an option there too.
Okay, I might have to check out that valerian combo that you have
Yeah,
there.
it's a
That
really good
sounds-
product.
Yeah.
I had a gal come in the other day with shingles, right? So
wow.
I muscle tested her. I put her on a couple of supplements to help, like L-lysine, which helps with shingles.
Yeah.
Which helps with any herpes zoster or herpes simplex. I put her on that, but she muscle tested really good to that. I put her on Immuplex to help to support the immune system.
Right.
What else? I put her on one other thing, I think. But we got her, I put her on a viral homeopathic. She tested really good to the viral homeopathic. And then we were gonna have her make a salve to put on the lesions, made from, it just escaped me. I have a particular lotion that you can put on it mixed with another herbal product, and we're gonna put that on as a salve.
Okay.
right? So you work on it from the inside as well as work on it from the outside.
Okay, so, well, you're actually making the case now for why, and like you said, every chiropractor doesn't do this.
Correct.
But you being a holistic chiropractic doctor, so, and I was saying, making the case for our first show where we said that chiropractic care is a mind-body holistic approach to wellness. And it is because everything you're talking about, comes from the brain's, going into the, the nervous system and the nerves innervating the organs and everything. So it is really a holistic approach. And I like that you also shared that you don't have to have, your neck cracked or your back cracked, and that might create some hesitation on some people who might want to see a chiropractor, but is unsure about what could happen, because some people feel that because it does affect the nervous system, some people are afraid of they might get a stroke, or they might have, I don't know, a heart attack or whatever, just by getting a chiropractic adjustment. But I'm sure that's very rare. Those things don't, really, I've never heard of anyone. I've heard of people getting stroke, but not really anything else. So is there anything you want to say about what would be contraindicated to getting a chiropractic adjustment? Are there any contraindications?
Yes, like we touched upon it earlier, we talked about osteopenia or osteoporosis. You got to be very careful with the manual or the cracking style of adjustment. So therefore, you would want to make sure your chiropractor uses things like instrument adjusting to make the adjustments. So that's much safer. If a person has a history of stroke or in their family and they're concerned about it, it's an easy. We don't have to crack your neck. We can indeed just use an instrument to adjust it. So those are things that would, be contraindications for certain people.
What about aneurysm? If someone has a blood clot or aneurysms,
Absolutely. You got to be very careful of that.
Uh-huh.
But how do diagnosing that? We need the help of our medical doctors, because
if
we don't
they
diagnose
know.
those things.
Yeah, but if they knew that they had an aneurysm, if they knew they had issue with blood clots, would it be safe to come to a chiropractor?
Yes.
Oh, okay.
But you just have to be aware of that.
Okay.
Right. And then you work, you're not going to do I don't do like the percussive massager on an area where there's a blood clot.
Okay.
Right. So you're not going to agitate that area.
Right.
So knowing it sometimes is the challenge ahead of time. Right. I had a patient today that she has, unfortunately, a brain tumor.
Oh,
right.
Okay.
And so she's had 2 brain surgeries. She's got staples all in her head here from the surgery. She's had her second surgery. But she's still coming in and getting adjustments.
Okay.
And I used the instrument. I used to actually crack her when she used to get adjusted. She liked the manual adjusting, but now I'm not going to do any rough adjusting, any stronger adjusting. I'm using the instrument, and she actually liked the percussive massager. I'm doing some manual massaging on her as well, some gentle stretching. No, I'm just doing by hand. I've been like her lower legs. She was she had a stroke after the second surgery. So she's feeling that, but she feels better getting adjustments. So it's helping with the quality of her life. It's not a cure for her cancer, but it helps her to just feel better as a human being while she's fighting this cancer. Right. Okay. Isn't that
again, it's addressing that stress.
Yeah, she's addressing the
stress. She probably has a lot of tension in her muscles.
And she's trying to recover and she already, after just 2 adjustments this week, her family is noting that she's actually walking better with the walker.
Wow. Okay.
Right. So it's pretty cool.
That
right.
is very cool.
But again, it's a process of communication. Right. So she obviously, I told her I will not do any strong manual adjusting on you. I'm only going to use the instrument because we got to be gentle.
Right. So it wasn't like you said she was coming to you before she was even diagnosed with it. Okay. Okay. Well, I think we pretty much covered a lot of conditions that may be considered common conditions. Are there any other conditions that you can think of that might be considered common that can be treated with chiropractic? Yeah,
I mean, so whether people have headaches or whether they have any type of neck pain or mid-back pain or any of the areas that we've already talked about, there are many different ways of helping to manage those areas, whether it's going to the chiropractor, going to the physical therapist, getting massages, getting acupuncture. I like to work with all the other professions. I think we should be synergistically working together.
And you have done that. You've done that with Detroit Red Wings. You said you did that with the Detroit Tigers for a while. So you've been on a team of experts or medical professionals to help support for at least for athletes.
Yeah.
Right. So
unfortunately, the average Joe doesn't get treated like a professional athlete.
well, this is true.
It would be wonderful if we had that team work going on for the average person coming in. And I've tried to create that as best I can. I have massage therapy in my office. I have nutrition. I have chiropractic. So I try to create that environment as best I can.
Well, that's personally what attracted me to your office in the first place, is because you did have more, you had a holistic services, and nothing against, conventional medicine, everything has its place, but I think, it has always been at least supportive to me and for my husband. I mean, he's been coming to you for 20 or 19, as long as we've been married, at least. So I think that it's a very important tool to have in your toolkit, and especially if you have a chiropractor that does all this other adjunct services as well. So I'm trying to think, is there anything that we're missing? Headaches is a big thing. People that have migraines, and even people that have eye problems. Again, I know you said that there isn't a specific vertebrae that goes to the eyes or whatever, but or to whatever the issue is, but it kind of reminds me a little bit in a way of acupuncture, though, because if you think about how acupuncture works along certain meridian points or lines in the body, and if you look at a acupuncture chart, it actually looks like nerve endings coming out.
There's no doubt that there's overlap there.
There's overlap. Exactly.
And again, we can adjunctively work together.
You can adjunctively work together, right? So I know when I was in massage school, we had a chiropractor that came in to talk, and one of the things that he said was sometimes subluxations can be caused by either a muscle pulling the vertebrae out of place, or even a subluxation causing the muscle to be tense too. Is that true? I mean, do you agree with that? That
what came first, the chicken or the egg?
What came first, the chicken or the egg, right?
So in Dr. Goodhart's teaching of applied kinesiology, he talked about the muscle balance, right? So if a muscle gets strained and weakened on one side of the body, the muscle on the opposite side of the body will now start to become tighter, because it's like a tug of war, right? They're not balanced. So the idea or notion is you can find the muscles that are knotted, that are overly tight, but you also want to be mindful that there's probably a weakness somewhere that's happening at the same time with that. So trying to address, when you adjust the spine, it sort of balances that right back out. Right. So the hypertonic muscle relaxes and the weak muscle tones back up. Right. So the adjustments help to balance that out. And there's other techniques, massage, some of the reflex techniques that I utilize. They help to balance the muscles out. So I get patients coming in, and let's say their hip flexors are weak. So I can stimulate different reflex points on the surface of the body that will re-energize the hip flexor so it becomes strong again. Or you can adjust a vertebrae that will re-strengthen a muscle. But you can also go to muscles that are hypertonic or knotted, and you can do trigger point work to release those. So I try to work on both ends of that. I don't know which one came first. Each case scenario is going to be different.
It's going to be different depending upon the individual, almost.
Because to me, a vertebrae can't get out of alignment unless a muscle is pulling on it. Right.
That makes sense. Okay.
So if you're sleeping funny with your head kinked up by a pillow, you're probably creating some strain in some of the muscles and ligaments. And then when you wake up and you go, oh man, I slept wrong on my neck. It's because you created that muscle imbalance from the posture that you were in. And now you're stuck in a subluxation pattern or a misalignment, and then getting adjustments can help to release that.
Okay, so then, chiropractic can also help to align the spine, so to speak. You know, if your muscles are like you just said, if one, it
I
can
look at it
cause,
as it balances the spine versus aligning the spine,
I see. Okay.
right? So there are techniques that try to structurally, so I have a gal who's a young gal, she has chronic headaches,
Okay.
and I had an x-ray, I sent her out for an x-ray. She has a reduction. When you look at the spine from the side view, there should be a forward curvature in the spine from the side view called the lordosis. She has a straightening of her spine. So I put her on a device called the posture pump, which can start to help to nurture that curve back into the spine. So yes, you can start to realign it, but you can't just adjust it back into alignment. You got to do exercises, and you have to do devices potentially to help with the to restructure the spine.
Okay, so in essence, you have to do your due diligence of self-care in addition to
Yes.
chiropractic and any other, alternative or adjunct wellness approach that you use.
Absolutely.
Okay, well, I think we've covered quite a bit today. I want to thank you again for coming back, and unless you have anything else for us, before we go.
I've got lots of stories.
Okay,
but
lots of
we
stories.
don't have time for
Okay,
it.
okay. Maybe next time if we.
I shared a few. I shared
again.
a few stories with
Yeah.
you, but
Okay.
there's each person has to decide whether they want to incorporate things like chiropractic or massage therapy into their lifestyle,
Or yoga.
or yoga
Oh,
and
all
exercise.
these things.
So I encourage people, even when it comes, we didn't touch upon diet, but there's a lot of different ways of eating out there, keto or paleo or vegan and all that stuff. I'm a proponent of eating fresh, whole foods, right? And controlling our insulin, right? Insulin is a key to a lot of
this
health
is true.
issues, right?
That was
So
another
getting
one
away
I
from all
wanted
that
to.
processed, refined
Yeah.
foods, the sugars, all the seed oils, all this
Mhm.
processed man adulterated foods. We got to get away from that and start eating fresh, raw vegetables, cooked vegetables, fresh fruits, lean cuts of meat, fish, and poultry. If you want to be a carnivore or omnivore, or doing the vegetarian,
Vegan.
but you can be a vegan and you can be a
Yeah,
terrible processed food eater,
Well, this is
and that's
true.
not healthy.
This is true.
Right?
Yeah.
You got to eat real foods, even if you're
That's
a vegan,
true.
right? So
Okay.
getting away from all the packaged processed foods is my sort of. You mentioned about did I have a dietitian? I've had them in the past. I just found it people did not want to change the way they eat.
Well,
It is crazy, but so I just try to give more general advice now. I give them specific nutritional supplements to address a liver that's not functioning properly and detoxifying their body, or to address the strengthening the thyroid gland, or to address strengthening the adrenal glands. But I don't try to do specific dietary, like, oh, you got to eat this way. I try to be more general with that.
Right.
Because I know people are going to choose the way they want to eat anyway.
Choose the way they want to eat. Yeah. Yeah. I was always taught you can't tell a person what to eat. You can't tell them who to love, and you can't tell them what political views they should have. And I'm sure there's some other things.
Well, a wise person told you that.
Yeah, wise person told me that. So, well, I think we're pretty much out of
All
time.
right.
And if you want to call Dr. Bloom's office and get more information on any videos that he has on YouTube, or if you just want to get some general information, or if you want to make an appointment, you can, give him a call, and you want to share the number or contact number.
My office
information.
number is 313-561-2199.
And
Give my office a call if you have any questions, and hope to hear from you in the future.
all right, that's 313-561-2199. And I know that by heart because I've been coming here for so long.
Yeah.
Okay, so thank you so much for joining me today. I hope you've enjoyed our show with or our podcast with Dr. Bloom, and you'll give him a call. If you have any comments or questions, I'd love for you to send me an email. You can email me at namastewellness@outlook.com. That's NAMASTEWELLNESS@outlook.com. Until next time, stay safe, stay well. Namaste.